Assalamu alaikum. First of all, I'd like to thank Dr. Ahmed Al-Askar for his kind invitation and all the committee of the SSBMT. And I'd like to show you our more than 25 years of experience in hematopoietic stem cell transplant. Indications of hematopoietic stem cell transplant according to the EBMT: myeloma is the first, followed by non-Hodgkin lymphoma, AML, MDS, MBN, ALL, and other malignant diseases. The indications of transplant according to standard of care, clinical option, or developmental, according to each disease and the recommendation of the working group. Hematopoietic stem cell sources, either bone marrow stem cells or peripheral blood. More bone marrow stem cells collected under general anesthesia in the operating theater. Peripheral blood collection of hematopoietic stem cells from peripheral blood using cell separator or cord blood stem cells. Hematopoietic stem cell sources, cord blood, bone marrow versus peripheral blood. Bone marrow done under general anesthesia, peripheral blood no general anesthesia, multiple punctures with bone marrow, not in peripheral blood. Pain at the site of puncture, yes, in bone marrow, not in peripheral blood. Hospitalization required in bone marrow. Engraftment is slower with bone marrow and faster in peripheral blood. Allo stem cell transplant T cell content is lower in bone marrow and higher in peripheral blood. Conditioning regimens used for allogenic hematopoietic stem cell transplant, either REC or MAC. Myeloablative, difference between both. Risk of relapse is lower with MAC, higher in REC. Risk of GVHD is higher with MAC, lower with REC. Transplant-related mortality is higher with MAC, lower with REC. GVL is common or more in MAC and REC. Indications: younger patients and with no comorbidities are indicated for MAC. REC is indicated for older patients or with comorbidities. This is the centers participating with the EBMT. We are there. Egypt has almost 13 or more than 13 transplant centers today. Nasser Institute is the biggest and the oldest one. We have 30 cabins for transplant. Numbers we did through the years, a lot of years, past years. We did almost more than 8,000 transplants through this more than 25 years. The challenges of bone marrow transplant in Egypt: lack of donor related, lack of matched unrelated donor. In Egypt, only 40% of patients who have siblings are expected to have HLA identical donor. Less than 30% of donors listed in the international registries are of Oriental origin, which makes it difficult to find a matched unrelated donor. HLA haploidentical stem cell transplantation is another alternative treatment modality where only one HLA haplotype is matched with individuals. We started haplotransplant since 2016. Haplohematopoietic stem cell transplant is alternative for patients who didn't have a fully matched donor. Recipient challenges for hematopoietic stem cell transplant: comorbidities, wait list, source of stem cell, socioeconomic status, consanguinity and certain genetic diseases, GVHD risk and management, minimal residual disease assessment, availability and cost of new drugs. Allogenic hematopoietic stem cell transplantation statistics in Egypt: overall survival in Nasser Institute around 64% for all categories or diseases. Allogenic hematopoietic stem cell transplant for malignant hematological diseases. Indications of AML transplant, you all know that. CR1 clinical options for intermediate and high risk, we do a transplant as a standard of care or more than CR1. Matched related donor allogenic hematopoietic stem cell transplant for AML, overall survival by CR in Nasser Institute in patients less than 18 years, around 60 overall survival, around 64%, 74% in CR1, around 67% in CR2. Overall survival for matched related donor hematopoietic stem cell transplant AML patients by CR for patients more than 18 years, around 65% in CR1, around 51% for more than CR1. Also, according to the EBMT data from the USA shows that The overall survival in AML patients in CR1 less than 18 years, it is around 75%. In CR2, it is around almost 70%. Also, survival after match-related donor hematopoietic stem cell transplant for AML patients more than 18 years in the USA, for CR1 it is around 60%, for CR2 it is around almost 55%. Hematopoietic stem cell transplant in MDS, it is a transplant for refractory anemia patients who are refractory to treatment, refractory anemia with excess blasts, or refractory anemia, or patients with transformation to acute myeloid leukemia. Match-related donor allohematopoietic stem cell transplant for MDS in Nasser Institute shows that overall survival around 52%. Survival for hematopoietic stem cell transplant myelodysplastic syndrome for patients more than 18 years in the USA, also it is around 55% for match-related donors. Indications for ALL transplant: with transplant patients with ALL with high-risk cytogenetics, or didn't achieve negative MRD, or patient more than CR1. Match-related donor allohematopoietic stem cell transplant for ALL patients, event-free survival by CR for patients who are more than 18 years, it's around 65% for CR1 and around 55% for more than CR1. Survival after match-related donor hematopoietic stem cell transplant for acute lymphoblastic leukemia more than 18 years in the USA, according to EBMT, it is also around 60% or 65% for CR1 and 55% for more than CR1. Hematopoietic stem cell transplant for CML, almost all didn't do hematopoietic stem cell transplant for CML, but we still do that for patients who are chronic phase, who are resistant to more than one second generation TKI. We use MAC. MAC doesn't offer advantages for RIC over RIC. Patients should be monitored for after transplant by qRT-PCR and treated with TKI or DLI if it's started molecular relapse. Patients in accelerated phase who didn't achieve an optimal response with the TKIs. Patients in plastic crisis, we should intensive chemotherapy and TKIs, then followed by consolidation by allo stem cell transplant. Allogenic transplantation in benign hematological diseases. Benign disorder transplant for sickle cell, for severe aplastic anemia, beta thalassemia. Sickle cell, we didn't have a long experience with it. Match-related donor transplant for severe aplastic anemia by age, for patients more than 18 years, for patients less than 18 years of old, overall survival around 75%. For patients more than 18 years old, it is around 55%. Survival after allogenic hematopoietic stem cell transplant for severe aplastic anemia in the USA in patients less than 18 years, it is almost around 90%. Survival after allogenic hematopoietic stem cell transplant for severe aplastic anemia in patients more than 18 years, it is around 85%. Beta thalassemia major, it is the most common hereditary hemolytic anemia. The incidence of carrier state is 9 to 11%. Allohematopoietic stem cell transplant is the only treatment modality that eradicates the thalassemia clone or reach a stable chimeric status to avoid blood transfusion. Overall survival of beta thalassemia patients after transplant, or for all categories, class 1, class 2, class 3, it is around 85%. Overall survival of beta thalassemia patients after allohematopoietic stem cell transplant per stem cell source, for those who received peripheral blood, overall survival was around 85%. For those who received bone marrow stem cells, it is around 83%. Autologous transplantation, overall survival for multiple myeloma patients after auto-transplant in Nasser Institute, overall survival around 45%. According to IBMR, in USA it is almost the same or higher a little bit. Overall survival of non-Hodgkin lymphoma patients after auto-transplant around 60%. Also in diffuse large B-cell lymphoma for auto, the outcome is 60% almost. Overall survival of Hodgkin lymphoma patients after auto-transplant, it is around 65% in Nasser Institute. Thank you.